You wake up in the morning, and the first thing you do even before getting out of bed is clear your throat, trying to get rid of that annoying phlegm. You cough, you swallow, you try to breathe deeply, but it feels like there is always something stuck there, something thick that never really goes away. You have tried everything: honey, hot tea, steam, even those syrups from the pharmacy, but nothing seems to work for more than a few hours at most. What you probably do not know is that the real cause of all this discomfort might be sitting right there in your medicine cabinet, in plain sight. And today, you are going to discover exactly which medications are silently filling your airways with excess mucus and what you can actually do about it. In this video, you will learn about 5 common medications that may be causing excess phlegm and mucus in your airways without you suspecting it. You will discover the hidden mechanisms behind each one, why doctors rarely mention this side effect, and what signs you should watch for in your body. And the last one on this list will completely shock you because it is a medication millions of people take every single day for years without any idea. If this information helps you today, please give this video a thumbs up, subscribe to the channel and turn on notifications so you never miss content like this. Share this with a family member or friend who has been struggling with chronic phlegm, and let me know in the comments, have you been dealing with this problem too? Most people believe that excess phlegm and mucus after 55 is just part of getting older, or that it always means you have a cold or an allergy acting up. But science has proven otherwise. Research published in major respiratory medicine journals shows that certain medications trigger mucus production through very specific mechanisms. Think of your airways like a garden hose. When everything is working normally, a thin layer of mucus keeps things moist and traps dust and germs just enough to protect you. But some medications change the chemistry inside that hose. They either make the walls produce too much mucus, or they weaken your body's ability to clear it out naturally. And here is the part that changes everything. Researchers analyzed over 247,000 patients and found nearly 2,000 medications linked to respiratory complaints. The medications used most often by people over 55, especially for the heart and blood pressure, were at the very top of that list, causing chronic cough and phlegm. The good news is that once you identify the medication responsible, there are alternatives, adjustments or solutions that can give you relief within days, not months. So let's go through the 5 most common medications that may be filling your airways with mucus right now, starting with one you have definitely heard of before. Medication number 1, ACE inhibitors. The blood pressure pill almost no one connects to phlegm. Medications like enalapril, lisinopril and captopril are incredibly common. Millions of people over 55 take them every single day to control high blood pressure or to protect the heart after a heart attack. And they work very well for that purpose. But here is what most people do not know. ACE inhibitors block an enzyme in your body called angiotensin-converting enzyme, and that enzyme normally breaks down 2 substances. Those 2 substances are called bradykinin and substance P, and when the enzyme is blocked, bradykinin and substance P start to build up in your throat and upper airways instead. Bradykinin is a powerful chemical that makes blood vessels expand and causes inflammation, and when it accumulates in the lining of your throat, it triggers irritation and mucus production. Studies show that anywhere from 5% to 35% of people taking ACE inhibitors develop a chronic cough, and many also experience nasal congestion and post-nasal drip. That thick feeling in your throat, that constant need to clear it, that annoying tickle that makes you cough at night, all of that can come from this medication side effect. The tricky part is that this side effect can start weeks or even months after you begin taking the medication, so most people never make the connection between the pill and the phlegm. And because the cough is usually dry at first, doctors often assume it is something else like allergies or asthma, and they prescribe even more medications to treat those symptoms. But research published in leading cardiology journals confirms that the only truly effective treatment for ACE inhibitor-induced cough is to stop taking the medication and switch to another option. If you have been taking an ACE inhibitor for months or years, and you also have chronic throat clearing, mucus, or a nagging cough, this could absolutely be the cause of your problem. The good news is that there are excellent alternatives. A class of medications called ARBs, angiotensin receptor blockers, work almost the same way but without affecting bradykinin levels. Medications like losartan, valsartan and telmisartan are just as effective for blood pressure and heart protection, but they do not cause the same buildup of irritating chemicals in your airways. One major mistake people make is assuming that because the medication was prescribed by a doctor, they just have to live with the side effects, and that is absolutely not true at all. Another mistake is stopping the medication suddenly without talking to a doctor first, which can cause your blood pressure to spike dangerously, so never do that on your own, ever. If you suspect your ACE inhibitor is causing excess mucus, write down your symptoms, note when they started, and bring that information to your next doctor's appointment to discuss alternatives. Many people report that within just 1 to 2 weeks of switching from an ACE inhibitor to an ARB, the chronic cough and throat mucus completely disappear, and they feel like themselves again. It is also important to know that this side effect is more common in women than in men, and it tends to be worse in people who are also taking other medications at the same time. So if you are taking an ACE inhibitor, along with a diuretic or a statin, which many people over 55 do, the risk of developing this mucus problem goes up even more than usual. Bottom line, ACE inhibitors are excellent medications for the heart, but if you have chronic phlegm and throat clearing, this could be the hidden cause, and there are very good alternatives available. Medication number 2, beta blockers, the heart pill that can make your airways tighten and fill with mucus. Medications like propranolol, atenolol, and metoprolol are prescribed for many reasons. Doctors use them to control high blood pressure, treat irregular heartbeats, prevent migraines, and protect the heart after a heart attack, so they are incredibly common in people over 55. But beta blockers work by blocking receptors in your body called beta receptors, and there are 2 main types of these receptors: beta 1 receptors in the heart and beta 2 receptors. Beta 2 receptors are found in the lungs, and they help keep your airways open and relaxed so you can breathe easily. But when you block those receptors, the airways can start to tighten. When the airways tighten, another system in your body takes over, the cholinergic system, which is controlled by a chemical called acetylcholine, and that system promotes mucus secretion and constriction. So beta blockers can create a double problem. They make the airways narrower, and they also increase the amount of mucus your lungs produce, especially if you already have asthma or COPD. Research published in the European Respiratory Journal shows that non-selective beta blockers, like propranolol, carry the highest risk because they block both beta 1 and beta 2 receptors at once. Cardio-selective beta blockers, like metoprolol and atenolol, are safer because they mainly target the heart, but even those can still cause breathing problems in people with pre-existing lung conditions or sensitivities. If you've been taking a beta blocker and you notice that you feel short of breath, or that you are coughing up more phlegm than usual, this medication could absolutely be the reason. One major sign to watch for is wheezing, especially at night or after physical activity, because that is a clear sign that your airways are constricted and producing extra mucus as a protective response. Another sign is feeling like you cannot take a full deep breath, like there is always something blocking the air from getting all the way in, and that feeling gets worse when you lie down flat. Studies show that people over 65 are especially vulnerable to this side effect, because lung function naturally declines with age, and beta blockers can make that decline feel much more noticeable. The mistake many people make is assuming that shortness of breath or mucus production is just part of getting older, or that it is a separate lung problem, when it is actually the medication causing it. Another big mistake is using an inhaler for asthma or COPD that contains a beta-2 agonist, like albuterol, because beta blockers can block the effects of that inhaler and make it less effective. If you are taking a beta blocker and you also use a rescue inhaler, and you notice the inhaler does not seem to work as well as it used to, this interaction could be the reason why. To use beta blockers safely, you need to have an honest conversation with your doctor about any history of asthma, COPD, or chronic bronchitis, because those conditions increase your risk significantly. If you already have lung disease and your doctor prescribes a beta blocker, ask specifically about cardio-selective options and ask if there are alternative medications that do not affect the lungs at all. Many people find that switching from a non-selective beta blocker to a cardio-selective one, or switching to a completely different class of medication, resolves their breathing problems within just a few weeks. Never stop taking a beta blocker suddenly on your own, because that can cause a dangerous rebound effect with your heart rate and blood pressure, so any changes must be done gradually under medical supervision. Bottom line, beta blockers are life-saving medications for many people, but they can tighten your airways and increase mucus production, especially if you have any history of lung problems at all. Medication number 3, inhaled corticosteroids, the respiratory medication that can actually make mucus worse, and this one surprises almost everyone who hears it for the first time because it sounds completely backwards. Inhaled corticosteroids like fluticasone, budesonide, and beclomethasone are prescribed specifically to reduce inflammation in the lungs. They are used to treat asthma and COPD, conditions that already involve excess mucus. So how can a medication designed to help your lungs breathe better actually make mucus production worse? The answer lies in how these medications affect your immune system inside the airways over time. Corticosteroids are powerful anti-inflammatory drugs. They work by suppressing the immune response in the lungs, which reduces swelling and opens up the airways, and for many people, they work incredibly well for that purpose. But here is the part that researchers only recently discovered. Inhaled corticosteroids also suppress your body's natural antiviral defenses, and that suppression has a domino effect on mucus production in your airways. A study published by the National Institutes of Health showed that fluticasone propionate impairs the immune system's ability to fight off respiratory viruses, leading to delayed viral clearance from the lungs and increased viral replication. When the virus stays in your lungs longer, because your immune system is suppressed, your body responds by producing more of a thick, sticky mucus protein called MUC5AC, which is a major component of airway mucus. So the medication reduces inflammation, which is good, but it also weakens your defenses against viruses, which leads to more mucus production during infections, and that mucus becomes thicker and harder to clear out naturally. Another study found that among older adults with COPD who started using inhaled corticosteroids, higher doses were associated with an increased risk of hospitalization for pneumonia, partly because of this immune suppression and mucus buildup. If you are using an inhaled corticosteroid and you notice that every time you catch a cold or flu, it seems to last longer and produces way more phlegm than it used to, this could be why. Another sign to watch for is thick yellow or green mucus that takes weeks to clear, because that suggests your body is struggling to fight off an infection while the medication suppresses your natural immune response in the lungs. The paradox is that inhaled corticosteroids are essential for many people with severe asthma or COPD. They prevent life-threatening flare-ups, but they also come with this hidden risk of increased mucus during viral infections. One major mistake people make is using their inhaled corticosteroid incorrectly, not rinsing their mouth after each dose, which allows the medication to sit in the throat and promotes fungal infections and mucus buildup in the upper airways. Another mistake is using a higher dose than necessary for longer than necessary, because the risk of immune suppression and mucus problems increases with both the dose and the duration of use over time. To use inhaled corticosteroids safely, always rinse your mouth thoroughly with water after every single dose, spit the water out, do not swallow it, and brush your teeth if possible to remove any residue. Work with your doctor to find the lowest effective dose that controls your symptoms, and ask about combination inhalers that include a long-acting bronchodilator, which can help clear mucus more effectively than corticosteroids alone. If you are using an inhaled corticosteroid and you get a cold or flu, talk to your doctor right away, because they may adjust your dose temporarily or add another medication to help you clear the mucus faster. Some people benefit from using a mucus-thinning medication like guaifenesin or N-acetylcysteine while using inhaled corticosteroids, because those medications help break down the thick mucus and make it easier to cough up and clear out. Never stop using your inhaled corticosteroids suddenly without medical guidance, because that can trigger a severe asthma or COPD flare-up. But do have an honest conversation with your doctor about any mucus problems you are experiencing. Bottom line, inhaled corticosteroids are incredibly effective for lung disease, but they can suppress your antiviral immunity and increase mucus production during infections, so you need to use them correctly and watch for warning signs. Medication number 4, statins, the cholesterol pill that can trigger a chronic cough and mucus production, and this one catches people completely off guard because statins are seen as heart medications, not lung medications. Statins like atorvastatin, simvastatin, and pravastatin are among the most commonly prescribed medications in the world. Millions of people over 55 take them every day to lower cholesterol and reduce heart disease risk. But research shows that some people who take statins develop a persistent dry cough, and in some cases, that cough is accompanied by mucus production, throat irritation, and a constant need to clear the throat. One study found that patients diagnosed with high cholesterol who were treated with statins experienced cough as an adverse effect, and when they stopped taking the medication, the cough resolved within 7 to 15 days. The mechanism behind statin-induced cough is not completely understood yet, but researchers believe it involves increased production of two substances, prostacyclin and nitric oxide, both of which can irritate the airways and trigger coughing. Another important finding is that the risk of developing a cough from statins is even higher when statins are taken together with ACE inhibitors, which we talked about earlier, because both medications affect similar pathways. An analysis of 3 large international adverse event databases showed that 88% of patients with statin-induced cough had no identifiable lung injury, meaning the cough was a direct pharmacological effect of the medication itself. If you started taking a statin within the last few months, and you also started experiencing a dry, nagging cough or increased throat mucus around the same time, this medication could absolutely be the cause. One sign to watch for is a cough that gets worse at night or when you lie down, because that suggests the irritation is happening in the upper airways and throat, not deep in the lungs. Another sign is that the cough does not respond to typical cough medicines, allergy medications, or inhalers, because it is not caused by infection, allergies, or asthma. It is caused by the medication's chemical effect. The mistake many people make is assuming the cough must be from something else, like a lingering cold or seasonal allergies, so they never mention it to their doctor or connect it to the statin at all. Another big mistake is taking cough suppressants or other over-the-counter medications to mask the cough, instead of addressing the root cause, which is the statin itself, and that just prolongs the problem unnecessarily. If you suspect your statin is causing a chronic cough or mucus, do not stop taking it on your own, because stopping a statin suddenly can increase your risk of a heart attack or stroke, especially if you have existing heart disease. Instead, talk to your doctor about your symptoms and ask if you can try a different statin, because not all statins affect people the same way. Some people tolerate one type better than another without any cough. Another option is to lower the dose of your current statin and see if the cough improves, or to switch to a non-statin cholesterol medication like ezetimibe, which works differently and does not cause cough. Many doctors are not aware of the connection between statins and chronic cough because it is a less common side effect compared to muscle pain, so you may need to bring this information to their attention yourself. If you do switch medications or lower your dose, keep track of your symptoms for at least 2 to 3 weeks, because that is how long it typically takes for statin-induced cough to resolve after the medication is adjusted. It is also worth noting that statin-induced cough seems to be more common in people who are also taking ACE inhibitors, beta blockers, or other medications that affect the respiratory system, so the combination increases your risk. To protect yourself, make a list of every medication you are taking, including over-the-counter supplements, and review that list with your doctor to identify any possible interactions or cumulative effects on your airways. Bottom line, statins are life-saving medications for heart health, but they can cause a chronic cough and mucus production in some people, and if that is happening to you, there are alternatives worth discussing. Medication number 5, calcium channel blockers. The blood pressure pill that causes mucus through a hidden pathway, and this is the most surprising item on the entire list because the connection is so indirect. Calcium channel blockers like amlodipine, nifedipine, and diltiazem are extremely common medications for high blood pressure and chest pain. Millions of people over 55 take them every single day without any issues. But here is what almost no one realizes. Calcium channel blockers relax smooth muscle throughout your entire body, not just in your blood vessels. They also relax the muscles in your esophagus and stomach. When the muscles at the bottom of your esophagus relax too much, the valve that normally keeps stomach acid down in your stomach stops working properly, and acid starts to creep up into your throat. This condition is called gastroesophageal reflux disease, or GERD, and when the acid reaches your throat and voice box, it is called laryngopharyngeal reflux, which is often completely silent with no heartburn at all. The acid irritates the delicate tissues in your throat and voice box, and your body responds by producing extra mucus as a protective mechanism to coat and soothe the irritated areas, and that is where the phlegm comes from. Research shows that the mucosa of the pharynx and larynx is much less resistant to stomach acid than the lining of the esophagus, so even small amounts of acid can cause significant inflammation and mucus production up there. A study published in PubMed Central confirmed that laryngopharyngeal reflux is mediated by acid stimulation of vagal nerves and direct contact of gastric contents with the throat, and calcium channel blockers make this problem significantly worse. If you're taking a calcium channel blocker and you notice a constant feeling of mucus in your throat, especially in the morning, or a need to clear your throat after meals, this could absolutely be reflux-related. Other signs to watch for include a sour or bitter taste in your mouth, hoarseness or voice changes, a feeling of a lump in your throat, or a chronic cough that gets worse after eating or lying down flat. Many people with laryngopharyngeal reflux caused by calcium channel blockers have no heartburn at all, so they never suspect reflux is the problem. They just assume the mucus is from allergies or a sinus infection that never goes away. The big mistake people make is treating the mucus with antihistamines, decongestants, or nasal sprays, when the real problem is stomach acid creeping up into the throat because of the medication relaxing the esophageal valve. Another mistake is eating large meals or lying down soon after eating, because that makes reflux much worse, and when you are taking a calcium channel blocker, the risk of acid reaching your throat goes up even more. If you suspect your calcium channel blocker is causing reflux and mucus, start by making lifestyle changes. Eat smaller meals, avoid eating within 3 hours of bedtime, and elevate the head of your bed by 6 inches. Avoid trigger foods that relax the esophageal valve even more, like chocolate, caffeine, alcohol, peppermint, and fried or fatty foods, because those foods make reflux worse, especially when combined with this medication. Talk to your doctor about trying a different blood pressure medication that does not relax the esophageal valve, such as an ACE inhibitor, an ARB, or a diuretic, depending on your overall health and other conditions. Your doctor may also prescribe a proton pump inhibitor, or an H2 blocker, to reduce stomach acid production, which can help control the reflux and reduce mucus while you continue taking the calcium channel blocker. Some people find relief by taking their calcium channel blocker in the morning instead of at night, because that reduces the medication's effect on the esophageal valve during the hours when reflux is most likely to occur. It can take several weeks of treatment and lifestyle changes to see significant improvement in reflux-related mucus, so be patient and consistent with the plan and keep tracking your symptoms to share with your doctor. Bottom line, calcium channel blockers are excellent for blood pressure, but they can relax the valve in your esophagus and cause silent reflux that fills your throat with mucus, and most people never make that connection. So here is your action plan, starting today. Make a list of every medication you are currently taking, including the dose and how long you have been on each one. Next to each medication, write down any symptoms you have noticed since starting it, like cough, phlegm, throat clearing, shortness of breath, or hoarseness, even if they seem unrelated. Bring that list to your next doctor's appointment and ask directly if any of those medications could be contributing to your mucus or respiratory symptoms, and discuss possible alternatives. If you are taking multiple medications from this list, like an ACE inhibitor and a statin together, mention that combination specifically, because the risk of respiratory side effects increases significantly. Now for the cautions. Never stop or change any of these medications on your own, because doing so can cause serious health risks, including heart attack, stroke, or dangerous spikes in blood pressure. If you have kidney disease, heart failure, or if you're taking blood thinners, be extra cautious and make sure your doctor knows your full medical history before making any medication changes whatsoever. Imagine waking up tomorrow morning and taking that first breath without feeling like you need to clear your throat. Imagine going through an entire day without coughing or reaching for a tissue. If this video helped you today, please give it a thumbs up, share it with someone in your family who struggles with chronic phlegm, and check out the 2 videos on screen for more ways to protect your health. Take care of yourself, stay informed, and remember that small changes in your medications can make a huge difference in how you feel every single day. Thank you for watching. Take care of yourself, stay informed, and remember that small changes in your medications can make a huge difference in how you feel every single day. Thank you for watching.